I know the topic is diabetes, but we have to redefine and really look at diabetes in a different way. And it's about behavior. And we're going to talk a lot about feelings today. You know, diabetes, everybody knows, is a disease that involves a loss of sensation, but there's much more to the loss of sensation than the physical component. And I know a lot of you have heard me speak before about the biopsychosocial or psychospiritual component of chronic disease, but that's really what diabetes is about, especially because it is a monster that we have created through processed living. So we're going to go over human behavior, we're going to go over feelings, we're going to go over what processed living really is, and then we'll kind of build the story up into the disease that we're all familiar with. But we need to get comfortable with the unfamiliar aspect of this disease, understanding where it came from, how we created it, and how we really breeded this monster that we're dealing with right now. So diabetes has been largely ignored in the medical field, specifically in cardiovascular trials. So the first point I want to make, and by the way, this talk is going to be conversational and anybody can interrupt at any time, no problem. Diabetes is a vascular disease. That's one thing that we have to reorient and understand. And it's a vascular disease that traditionally has been omitted from cardiovascular teaching and trials. Literally, it has been excluded in the beginning because it throws everything off. It just mucks up data, it mucks up numbers, and it doesn't allow a hyper-focused look at bringing medications into the market, devices, because it's too confusing and it affects literally every body process. So diabetics have been disenfranchised from data for over 50 years. So the implications of that is that we have to relook at what the role of diabetes has really played over the past 100 to 150 years in a world that has been more collectively westernized. What do I mean by that? The number one risk factor for every problem that is fueling chronic disease in this country and around the world, and this country takes the lead by far, is diabetes. So if we plug diabetes back in to relooking at medicine, what we find is that insulin resistance, which is the true problem, is at the root cause of over 80% of cardiovascular disease. Literally, the way you can look at that as a dipstick is if you go to any hospital and you find out why people are admitted in a hospital, every disease process almost is related to diabetes. But it's not the number one reason that we look at as to why they're there. Why is that? It's because, again, diabetes has been disconnected from other disease processes, mainly chronic diseases. And also, the insulin resistance component has been ignored. And if we go back over 100 years, what we'll find out is that as diabetes used to be a disease of coma, because before treatment of diabetes, there was no way of taking care of kids that were developing diabetes and they just died. The next phase of diabetes in this country was managing the chronic complications of diabetes after we discovered insulin. So we shifted from having no cure. Literally, if you were a diabetic and admitted in a hospital over 100 years ago, you were given a regimen of olive oil, bacon, protein, just to wake up the brain from the negative consequences of the hyperglycemia. And they died. And the minute insulin was discovered, we were literally rolling kids out of the morgue. And there are pictures of this. I'm just not going to show them because they're pretty horrific, but they look like the Holocaust. Emaciated young children, weighing kilos, being rolled out of the morgue after being administered insulin. So after 1922, when we discovered the ability to harness insulin, people now had a new second chance at life. And the problem was that just like when presented any quick cure, we come at a disease of choice and behavior. And so what do I mean by that? The ability to have insulin to correct acutely diabetes, which is a problem with either not producing insulin or resistance to insulin, which we created, was that people said, well, now I can just take insulin, live life the way I want to, and do whatever I want. And so what that allows is diabetes to take its insulin resistance, the type 2 diabetes that we're all dealing with and talking about today. It allows it to continue to grow slowly like a cancer that you never knew you had. And then you get to see what it really does. And it affects every body system head to toe. And the one that we're specifically related to here today is peripheral artery disease. which diabetes fuels most of around the world. And so most of the speakers you're listening to today deal with a disease process called critical limb ischemia, which leads to amputation. And what that literally does is it severs a body part from the whole body. But that's exactly what diabetes does, is it starts to sever pieces of the body from the body. It starts to sever the person from their community, literally being isolated off with chronic diseases, not being able to walk, going blind, and being on dialysis. So I'm trying to build up a pattern for you so you can see what diabetes does. It causes a person not to feel. And the inability to feel is not just on the physical component, which leads to the foot deformities, which when combined with the peripheral artery disease, which diabetes accelerates because diabetes is a vascular disease, but losing the ability to feel physically, losing the ability to feel your body, and losing the connection from the community, from being amputated and having multiple chronic diseases, causes this massive problem of not being able to self-identify. People literally shut down because of this disease process and literally cannot connect with themselves. And so using diabetes as a great analogy or metaphor for a lot of things that are going on in the world, it's a fascinating disease process that allows us to understand what a biopsychosocial model of looking at chronic diseases can do when we start to understand that these are mostly diseases of human behavior. So diseases of human behavior involve a three-part cycle. They involve feelings, they involve thoughts, and they involve behaviors. That's why being educated, just like you are today, learning about the root causes, what the treatments are, what can be improved. If we start to educate our thoughts, then we can change behaviors. And if our behaviors change, we start to feel better. But if we intercept this cycle from feelings, if we address the fact that, hey, diabetes causes me to not be in touch with my body because I can't feel, because I have too much sugar in my body, then we can start to understand what the root cause is. And what it is hyper processing of life. So when we hyper process food, we remove meaning out of food, which means we no longer have anything that's nutritious. When we hyper process our lives, and think about what COVID has done to us. When life is hyper processed, we lose all meaning of psychosocial interaction. People lose connectedness. And when we have a hyper processed sense of self, when we're on autopilot, we forget who we are. And that's exactly what diabetes does to the body. It insidiously, slowly causes us to lose sensation by attacking the nerves, just like you heard in the previous talk. So if your nerves are on fire, that's one spectrum. They're short circuiting, right? People have what you typically think of as neuropathy. But if people lose sensation, then they have a disconnection from their body, which literally can lead to amputation. So critical limb ischemia is the end stage of peripheral artery disease. But there's also much more to what that represents. It represents critical life ischemia, and it also represents something that I call critical love ischemia. Essentially, it's the inability to separate what's going on from the patient from the disease process. So diabetes starts to overtake the identity of the person. Think about this. Diabetes is the #1 cause of blindness, dialysis, and amputation in this country. Imagine what living life as a blind, end-stage renal disease patient with amputation looks like. It's hard to look past that person in a wheelchair with one leg who's on dialysis as diabetes defining their entire life. And guess what? It happens. So how do you tease out the human being from there? Well, there's another big problem that happens, is that healing is replaced by healthcare. Living is replaced by a processed life, and profit is replaced over people. And that is my analogy for what processed healthcare and living does, which diabetes fuels, right? We can think of processed life in terms of food. That's easy because we take everything that's nutritious out of food and we put it in a box and we sell it to people. And that fuels insulin resistance. So by allowing us to process sugar over 100 years ago, we created the #1 addiction the world has ever seen to sugar, which literally has hijacked our taste buds. And anybody that has kids sees how fast that happens. So hyperprocessing food is related to behavior. And that's why it's so important to educate people on what the root source cause of the number one risk factor for cardiovascular disease, which is insulin resistance. So now we have a problem of health scare instead of being able to provide people with health care. And what the cause of that has created is diabetes. So the world is literally getting heavier, okay, with an affinity for carbohydrates that we've never seen before, because processed carbohydrates don't exist in nature. Now, man is so genius to not only take processed carbohydrates, but to combine them with what you heard before, bad fats, which also do not exist in nature. And that is the most addictive substance that man has ever created, more than cocaine, you know? So think about what neon lights, you drive by on a highway, a Krispy Kreme. That combination of fat and processed sugar doesn't exist in nature. So we weren't designed for that. And the body interprets that as an energy source correctly, which we store, which fuels insulin resistance, which creates this pandemic of diabetes. So really, the number one risk factor for PAD is diabetes, and diabetes is fueled by human behavior. And that human behavior severs us from our body, it severs us from the community, and it severs us from ourself. And that is something that healthcare needs to address if patients are to have proper healing instead of whatever we call this mess that we're in now. So many of us are dealing with the end stage of that, which is why we relate PAD and CLI so much to cancer, but the patients never know that they're dealing with it until they're given that diagnosis, which is why it's so scary. And so I want to end it by applauding the organization for raising awareness for this disease process. I think I'm attached to it, but it's the best example we have of just how much chronic disease severs us from the self, the community, and our identity. Thank you so much, Kim. I really appreciate being able to be here and talk with you guys, and I'll take any questions.
Thank you. We have Douglas, who is asking about the most successful diets you have seen your patients on.
So that's a great question. I don't like the word diet, but we'll use it for what it is. I think the best behavior modification strategy has to be tailored just like a prescription. So I literally take paper prescriptions, which don't have any meaning right now because it's all electronic, but I write it there so the patient understands. The most important thing they can leave with is information and education. It is not a prescription. And so it's tailored to the patient's body type, their physique, and their level of insulin resistance. For people that are endomorphs, who have an affinity to build truncal obesity, which automatically means insulin resistance, they have to go on some type of, for lack of a better word, a keto-like lifestyle to jumpstart insulin sensitivity. And our practice, we are geared towards taking people off medicines, not prescribing medicines. And I think that's really the measure of what a healing type healthcare practice should look like, if they allow patients to take control back of their own bodies in healthcare, not being subscribed to pills and being told what to do by physicians. So the number one thing is whatever it allows them to regain insulin sensitivity. And it's no different than what was done before insulin was discovered. Literally, when people were admitted, they were given healthy oils, healthy fats, healthy proteins to be able to bring down the sugar levels. And then they were given education. They weren't sent home from the hospital. They were actually admitted into cottages and little homes and taught as a community before being discharged back into the wild.
I think we should do that again. We have Monique that is here with a question. Monique, go ahead and unmute and ask Dr. Michael your question.
I have a question about apolipoprotein. What happens to it in diabetes, and why is it tested all the time by my internist?
So one of the best markers, inflammatory and lipid markers for cardiovascular disease is lipo-A. But the interesting thing is that if you look at what systems diabetes affects, so it's a vascular disease, therefore it's going to also interfere with every metabolic organ in the body. So if you look at the pancreas, the stomach, and the liver as a triad, okay, diabetes will affect the ability for the liver to process lipids because it is in a mode of storing energy. And if it's in a mode of storing energy, then the body doesn't understand that it needs to be able to break down fats and proteins to be able to create all the healthy carbohydrates that you need. So a marker of that relationship being inverted, which is also related to directly proportional to inflammation and also insulin sensitivity, is that marker. So that's why cardiologists are interested in it. The problem is, what do cardiologists want to immediately do? Is start prescribing people statins and anti-inflammatory medications. But really what needs to be targeted in conjunction with that is the behavior modification for the patient to increase their own insulin sensitivity. Does that make sense?
Oh, yeah. Mine was really low though, like 0.61.
Mm-hmm. Well, that has to be looked at in conjunction with the rest of your labs with your doctor. But I'm trying to give you what the gist of that is inflammatory markers and lipid markers that are markers for more disease to come. But I want you to look at it this way. Forget what your numbers are. Look at where you need to be and what you need to do, and those markers will come down as a trend. Triglycerides should come down. HDL should go up, okay? And the LDL should be at a healthy state. In the 80s, there was this problem called the cholesterol mafia, fueled by the statin business, which shifted people's awareness away from decreasing insulin resistance and to jumping on the prescription boat. And that caused a lot of people to subscribe to low-fat diets, which is totally wrong, against nature. It's not the way our bodies are designed. Healthy fats are good for us. Healthy proteins are good for us. There's no totalitarian diet that is right. And think about what we've been fighting about for forever in this country that societies and people can't agree on. It's what to put in our mouths. But if you were to show all this food to animals, they wouldn't even sniff it. They'd walk right away. I mean, you guys are talking about pets or something for pad. Think about how animals look at food. You put a bunch of options in front of them, they automatically go to what's right for them. But we have this paradox of choice that confuses us. And really what we need is a whole foods diet, not Whole Foods, but a whole foods diet, which is eliminating the processed human behavior out of the decision-making tree to allow our body to recalibrate so that the pancreas, the liver, and the stomach can function the way they're meant, instead of constantly being in this energy storing mode, which we're very efficient at.
And we have Anna who has a question. Anna, go ahead and unmute and you can ask your question of Dr. Michael.
Okay, thank you, Kim. Hi, Paul.
Hi.
Is there a either a direct or indirect correlation between insulin resistance and panic anxiety disorder?
Yes, there is. So insulin resistance can fuel so many things, not just in the cerebral vasculature, but it also affects a completely different system, which is the autonomic nervous system. And that system is it should be hyper tuned so that a human being can able to acknowledge their feelings, which then affects their thoughts, okay, which allows them to act or behave in a certain way. If the feelings component is dampened because of dysregulation of the autonomic nervous system, which diabetes is so good at, then patients may have no awareness or have a lower awareness of their fight or flight response, okay, and their stress response. So a patient may be stressed and not know it. You can thank diabetes for that. A patient may be overwhelmed, okay, their neuroendocrine circuit may be on fire and they may not feel it, okay? So that's why the first notable feature of hypoglycemia to a patient could be literally passing out, sweating, whereas somebody who is in the normal state would automatically pick that up and can adjust for that. Now translate that into emotion. So absolutely. And that's why in many trials, they say, oh, depression is the #1 cause of this, or is the #1 result of this. But I am sure that it can be backtracked and saying, well, why is it that patients don't have an awareness of the feelings? But if hyperglycemia and insulin resistance is affecting the autonomic nervous system, then you can believe that the ability to actually be aware of how you're feeling is affected as well.
So, Dr. Michael, we're getting requests to scale you around the world right now. Harvey wants to know, how do I find a doctor to work with me in this way for diabetes? Because what everyone seems to do is they just want to keep throwing out the drugs,
That is a great question. And so, and this is an approach I take with myself. About 80% of what I do today, I didn't see in fellowship because we had to create new techniques and procedures. So I did travel around the world. But people say, well, how'd you learn how to do that? And my answer is, and it's not facetious, YouTube. There is plenty of educational material now, thanks to technology. Everything has a negative and a positive component. I don't look at it right or wrong, but the more touches we can have in the positive direction, the better. And so technology now has given us the ability to communicate and to self-educate in a way that's never been seen before. We can't expect our physicians to give us everything we need. That's also a little bit, anyway. So basically we can educate, I can give you resources. There are really good institutes that I would say I would put my stamp of approval on. I will email you those, Kim. So these have my official, and that's what I give my patients.
We can go ahead and put them on our website.
30-minute version in the office. And then I'll say, watch this video, and not just you, watch it with your family, watch it with your kids. When things are done as a team, when partners do things together, whether it's diet modification, whether it's quitting smoking, whether it's reducing alcohol intake, that's including the psychosocial component into the approach, and the success just skyrockets from there.
And Michelle is on making everyone jealous because she gets to go to you, and most everyone on here cannot. We love Michelle. You've done such a great job with her. But any red flags when people are going online? There are so many different resources out there. Yes, you're going to be providing your trusted resources, but as people are going out online and Googling.
The red flags are going to be somebody trying to sell you something. Period. If there's a source of information that is just there to teach you, right? And it's not but wait, there's more, or, here's my supplement line, or here's my product. That's a good place to start. It doesn't mean that there aren't great people out there that are sponsored or supporting certain products, but I think something that is not tied to marketing or sales. That's a good start.
Enough said on that. I agree with you 100%. That is the number one red flag. And we have Kay that actually has a question for you. Kay, go ahead and unmute. This will be our final question for Dr. Michael.
Yeah, it's just you talking about diabetes mellitus being part of the cardiovascular circle. It's actually an autoimmune disease. So where does it actually fit in? Because the autoimmune affects the liver, it causes the fatty liver to actually occur. So where does it fit in as an autoimmune disease in your treatment of it?
That's a great question. So if you think of autoimmune disease and then you think of acquired immunodeficiency, okay, what were the two populations that COVID targeted?
That'd be the pulmonary and the diabetics.
Obese and diabetics.
Obesity.
And if you combine those two, you have diabetes. So if you reverse engineer susceptibility to immune disease, right? Look at what that target is. If you were some evil genius and you wanted to hurt the world, and specifically the West, you would target those two populations, the obese and the diabetics, because of insulin resistance, which fuels the obesity, and obesity fuels the insulin resistance. What that does is it creates an immunologic dysregulation. So hyperglycosylation, or high sugar, lowers the immune status.
Yes.
So that vicious loop of high sugar, obesity, and then immune dysregulation, insulin resistance, it fuels that. So the only way to undo it is to increase insulin sensitivity and improve the immune system. And earlier in one of the talks was talking about nutrition. So we are what we eat. And the best prescription is what we put in our mouth. How can we be so narcissistic to expect that we can do whatever we want and expect the healthcare system to fix it with a pill or a prescription? It doesn't work that way. Yeah. So for thousands of years, all healing was based on at the base level, what we put in our mouth, and then acknowledging the psychosocial component to diseases, which is really stress.
So we're differentiating there between diabetes 1 and diabetes 2.
Yes, diabetes 1, right, as an autoimmune disease, right? They just get it. We don't really know why. There's many theories, like kids. That's the inability to produce insulin, which leads to death.
Yeah.
But then that's why I said type 2 diabetes, which has been around, but not was in single digits.
It was, yes.
Single digits back in the day. We created this through human behavior.
Yeah, it's an endemic.
Just like now, we have a pandemic of psychiatric and psychological diseases. We're not integrating the psychosocial component, right? We are disenfranchising the human being from reality, which creates a lot of psychological disease. And COVID unveiled that too. Anxiety and depression has never been seen at this rate ever, not even in wartime. In wartime, we were previously able to rally as countries. Now look at what a virus is able to do. It picks us apart. So it shows you how frail we've become psychologically. That also causes stress response. And that stress response translates into immune dysfunction. If we have an awareness of that, that's why I said behavior. And so if we have awareness of what is fueling these things, then we have a better shot at working together to correct these problems.
Thank you so much, Dr. Paul Michael. We really appreciate you. If people want to get in touch with you afterwards, where can they go?
So our office number is 561-500-LEGS. Feel free to give out my personal email address to the entire group. I'd be happy to forward that on. And our website is palmbeachheartvascular.com.